There are many things in the air, what we eat, what we react to, that causes sinus congestion, pain in that sinus area, clogging, difficulty breathing. I have a technique that's going to do wonderful things for you. Fast, effective. We're going to utilize specific areas around the nasal septum that's going to make great changes for you. We're going to stimulate the brain, and we're going to do it naturally without the use of drugs or medications. And we're going to be working with the paranasal sinuses, which is a group of four-paired air-filled spaces that surround the nasal cavity. The maxillary sinuses are located under the eyes. The frontal sinuses are above the eyes. The ethmoidal sinuses are between the eyes, and the sphenoidal sinuses are behind the eyes. And all of these sinuses work together. But the most common type of sinus problems that we exhibit is the frontal sinus as well as the maxillary sinus. Difficulty breathing, pain in the cheekbones, problems within our middle ear because we have the eustachian tubes. And those are small little tubes that connect the middle ear to the back of the nose and upper throat. And these tubes play a crucial role in regulating ear pressure in the middle ear, draining fluid, and protecting the middle ear from pathogens. And it's quite common to get congested from the common cold, which is a virus, or the flu, or bacteria, or allergies, or any kind of pathogen that makes its way back into the nasal area. Those eustachian tubes stop draining. As they stop draining, they become more congested, causing more pain, and the problem can continue to linger on for a long, long time. So let me show you how fast and effective this technique is. There's two main things we're going to do. The first thing is nasal bridge tapping. So you're going to take your index finger or any finger you like, and I want you to start tapping right where the bridge of the nose meets the forehead, right in that area. But what you're going to do is you're going to come down. You can use two fingers. You're going to come down all the way down to the bottom of the nose and work your way back up. But I don't want the tapping hard. I want it more faster. I'm looking for vibration. We're stimulating nerve supply. We're stimulating circulation. And you're going to do this for about 20 seconds. Nice and light, but a lot of frequency, a lot of tapping. Up and down. Make sure you get right between up high near the forehead and then work your way down and come back up. Do that for about 20 seconds. This is going to stimulate neural sensory messages back to the brain. The brain's going to send messages back to the sinus area to help open and drain those sinuses and to allow you to breathe better. Now come down the side of the nasal area on the outside of the nostril. Take these two fingers and just hold that point right there. Just hold it. This is going to intensify what we just did. It's going to stimulate the brain even more. And go ahead and breathe in and out of your nose. You'll start to feel your nasal passages opening. Just holding this point. You'll hold this 15, 20 seconds. And now, the exciting part. Now I want you to take a nice deep breath. And when you take a deep breath, you're going to pinch your nose as you take that deep breath. And you're going to look all the way up at the ceiling as you change the pressure gradient in the sinus area. By doing so, we're going to stimulate back to the brain, change that pressure, allow the reflex to happen inside the sinus area so we can get that drainage immediately. So grab your nose, pinch it together. Take a deep breath through your mouth and look up to the ceiling. As you look up at the ceiling, pinching your nose, hold it there. Just keep holding it there. Don't breathe. Just keep holding your breath as long as you can. If it's 30 seconds, if it's 20 seconds, if it's a minute, it doesn't matter. Hold it as long as you can. And when you can't hold it anymore, I want you to let go of your nose and bring your head back to neutral as if you're looking straight ahead as you blow all the air out of your lungs and look straight ahead. Let's go, let go, and blow it out. Look ahead and take a deep breath again. And that's it. And you're going to see miracles. You're going to feel within seconds, within minutes, the changes start to happen. Your brain's going to tell those sinuses, hey, it's time to release, it's time to let go. And those nasal passages are going to open up and you're going to be shocked. You can do this technique several times a day. Do it whenever you need to. It's safe, it's very effective, and most important, I hope you feel much better. Please share this video with your friends and family. Leave your comments below. And most important, make it a great day. I'm Dr. Alan Mandell.